Hello, my name is Marianna Coulentianos, and I am presenting findings on stakeholder engagement with prototypes during early medical device design. Who is engaged with what prototypes? In this study, we define stakeholders as anyone who impacts or is impacted by the design of the device, meaning healthcare workers, patients, government officials and legislators, payers, facility trade groups, etc. We define prototypes as any representation of the device or its use, such as a drawing or a physical model. Stakeholder engagement with prototypes is well documented in the back end of medical device design. Users are often engaged through clinical trials and summative usability testing. In the early phases, stakeholders are engaged through interviews, focus groups, which might involve prototypes, and formative usability testing, for example, which informs safety and usability of devices and reveals unintended uses. The literature describes some practices for front-end stakeholder engagement, but it is still unclear what the trade-offs are. For example, design practitioners note limitations in the quality of feedback provided when stakeholders are presenting with preliminary drawings in comparison to more advanced physical prototypes. Hence, we ask, which stakeholders are engaged and with what prototypes? Indeed, both the prototype form used and the stakeholder group engaged affect the quantity and quality of feedback elicited during front-end design engagements. To answer these questions, we interviewed 22 participants, including engineers, designers, design researchers, and technology officers from 16 medical device companies. Semi-structured interviews were conducted, during which participants were asked to focus on a prior project and describe stakeholder engagement experiences in detail. Participants were asked which stakeholders were engaged and what prototypes were leveraged. From the transcript data, the study researchers established categories of stakeholders and prototypes through multiple iterations. Stakeholder prototype associations were then identified across multiple transcripts, and excerpts were extracted to illustrate participants' rationale for specific stakeholder prototype associations. The data revealed that design practitioners make deliberate choices to engage specific stakeholders with specific prototype forms. Participants used 3 different overarching forms of prototype to engage stakeholders during front-end design activities. Physical 3-dimensional prototypes, which included prototypes built with test materials or near-final materials, and even the use of existing products. 2-dimensional prototypes, such as photorealistic renderings and storyboards, and finally, digital 3D prototypes such as CAD models. Participants engaged 3 main types of stakeholders: users of the device, implementation stakeholders, such as a financial decision maker or a government and regulatory stakeholder, and expert advisors. I will now present a few examples of prototype stakeholder associations. Participants told us that users were often engaged with physical, tangible prototypes because having something concrete to talk about made it easier to have meaningful conversations early on. Government and regulatory stakeholders, which are part of the larger category of implementation stakeholders, cared more about the value the device could add. So a storyboard that depicted the different features was described as an impactful way of engaging that stakeholder group. Lastly, expert advisors who were more technically savvy were shown CAD models as a basis for discussing the inner workings of a prototype. Not one type of prototype was used exclusively with one type of stakeholder. For example, while we saw that CAD models were used with expert advisors to discuss technical aspects of the prototypes, they were sometimes shown to financial decision makers during design reviews within the company, and they were sometimes sent to users via email when face-to-face engagements was not possible. Hence, the decision of which prototype to use to engage which stakeholder is not clear-cut. But through this research, we've provided examples of how design practitioners make stakeholder prototype associations, which are based on the stakeholders group's interests and expertise, and the ability of the prototype form to convey a specific type of information. Understanding what current associations medical device designers make is the first step to improving stakeholder engagement with prototypes. The results of this study have the potential to impact medical device designers' early design practices. Thank you for your attention.